Phillip Yoo, the 21st Century Laser Stem Pain Institute, and today we are doing laser-guided umbilical cord stem cell therapy under ankle decompression. This gentleman wore his right talocrural ankle joint out. Years of soccer wear and tear, a lot of inversion sprains. Now the ankle joint is bone on bone. He does not want to have any type of fusion surgery, so what we're going to do is, this is decompressing the bone on bone talocrural joint to kind of loosen it up and open the space up, which will make a gap so the needle goes in unchallenged, and it'll make a vacuum where the stem cells will be sucked in, if you will, into the joint space to regenerate it. We're going to do it under laser guidance, so go ahead and disengage the traction mechanism, and we'll go ahead and grasp the cells. I'm going to mark it with the infrared thermometer because the stem cells will be signaled to home in on the area of greatest inflammation. In this case, it should be the anterior or medial aspect of the talocrural joint. The anterior is about 86, 87. If we go medial, right there, and lateral right here. Okay. Here's a spot here. Medial 88.6. Okay, so that's our first spot right there. Is that tender right there?
Yeah.
Yep. Is that the main spot that hurts, would you say?
I would say
Yeah.
so.
You see how accurate the infrared thermometer, it detects where the inflammation is greatest. This is where we're going to graft the majority of the cells. Right there. See that divot in there between the medial aspect of the talocrural joint? The needle's going to go in very nice right there. Okay, and we'll go ahead and graft the cells. We're going to put total cell volume is 10 million. Out of that, we got 4 to 5% mesenchymal stem cells, which is about 500,000. And we'll go ahead and disinfect that. Make sure the grasping tools are ready. I'm going to do it myself, and make sure the light stem is ready on hold. Okay.
So there's going to be one here.
Yep, and the angle we're going to graft it is going to be right. Slightly angled just like that, not totally down, like slightly like this, okay?
Mm-hmm.
Yeah, so I'll show you the angle. Not, if you look above it,
Mm-hmm.
about 10 degrees this way, okay?
Mm-hmm.
All right. I'll go ahead and decompress it.
Okay, ready for the ice?
Okay, this is ethyl chloride ice spray to numb it. So you feel the needle less. Let me decompress it first. Okay, go ahead and graft it. That's perfect. Angle it in a little more. Angle. Decompress. Okay, angle. Yeah, there you go. Go ahead and put half of this fluid in. Tell me when you feel it's filled.
It feels full.
Okay. Angle it towards his head. Okay. Push in. Good. There you go. Put the rest of it in.
Okay.
Yeah, we got to fill all the cavities of blood. See, not one drop of blood. And that's why the laser guidance system is so accurate, because we want to put it in the joint space that has the highest degree of inflammation. You can see the needle went in deep because I added decompression of the talocrural joint so we could fit the needle under laser guidance, okay? And now, to stimulate the stem cells, I'm going to actually irritate that ankle joint with my laser edge myofascial release tools. This is not only going to spread the cells around the talocrural ankle joint, it's kind of like prolotherapy. We're irritating the tissue to activate the healing processes like prolotherapy does. So you see how it's getting red here? So we're purposely causing temporary local inflammation to activate his endogenous stem cells to help the umbilical cord stem cells to work together to signal repair and regeneration of the cartilage space between the talocrural joint So I have different shapes. This is a convex surface on a concave anatomy. And then we use a concave tool so you get a little deeper on a convex surface and concavity right here below the talocrural joint. You feel that grinding in there, Mike?
Sure do.
Yeah, so you feel the grinding, that's the arthritic spurs.
Yeah.
That's the scar tissue adhesions that we're breaking down. Because we want to clean up the joint as much as we can in the soft tissue to make a clean scaffolding so the stem cells can signal the repair of the cartilage. So we have healthy tissue planes reforming. So breaking down these adhesions will stimulate the healing process after inflammation and pavementing, rolling. So all the soft tissue, the fascia, the tendons, the cartilage can graft in smooth planes to make better range of motion in the ankle. I'm going to work a little laterally too, because on X-ray and the CT image and MRIs it did show that you have some degeneration in the lateral aspect of the ankle. Typically when you have an inversion sprain, you tear the anterior talofibular ligament. So we want to make sure we irritate the lateral ankle. So some of these cells will be signaled to go repair the lateral side of the ankle too, but we want the majority to stay anterior and medially here, right around there. And then Captain Hook, this is my, call it the can opener. We can get a little deeper, fits right over the talocrural joint. See, feel that right there? Yeah, a lot of adhesions.
Yeah.
And right here, we want to work medially, right there. And then we're going to add the light emitting diode. And this has a laser wavelength of 630 nanometers, 810, which is ideal wavelength to cause photobiomodulation, activate the stem cells, stimulate the mitochondria to give ATP energy, so the cells will repair, regenerate, and replicate at a faster and longer rate. We do this a half hour. Then I'm going to send Michael home with the home unit, and he's going to do about a half hour a day. This is how we do things, and we'll do a reeval about a month, okay? Okay.